Okay, welcome everyone to our first United Appliance Servicers Association webinar. Today will be on how to save money on healthcare with insurance alternatives. On the right-hand side of your screen, if you have any questions, you can submit them via chat, and Kevin will get to them. He'll respond on the screen to your questions. I think we're ready to start. I'll turn it over to Kevin Kennedy with Small Association Leadership Alliance.
Great, thanks Sarah. Welcome everyone to today's webinar. We're going to be talking about the SALA healthcare program. There might be a slight delay as I transition through the slides, so I'm going to pause a little bit as I go through. Hopefully it will not be too much. And bringing the program together, we started this effort about 3 years ago, looking for a solution for all of us for the ever-increasing healthcare costs that we've had. And in doing so, we had two key points we were trying to address. One was to develop a national program, and then two was to develop a program that reduced costs in a meaningful way. And I say meaningful way because we didn't want to bring a program together that only reduced costs by 5 or 10%. So the program we're talking about today addresses both of these things, and I'll get into all of it in some detail. The program itself is really an effort to simplify what's become so complex with our healthcare. There's a choice of great solutions. I apologize, there is a delay on the slides here. There we go. Hopefully that's catching up for you. So there's a choice of affordable solutions for everyone to choose from or to mix and match as you see fit. It helps you all meet ACA regulations for preventative care. As you'll know, the Affordable Care Act defines certain aspects that we all had to have for our health care, and this plan meets those requirements. Even though the IRS penalties have gone away, certain states have instituted penalties for folks that do not have preventative care, and this program addresses all of those items. There's a 4-year rate lock on the preventative care side of the program, so the rates cannot increase more than 9% over the course of 4 years. And in fact, this year, there are no rate increases whatsoever. That last bullet there, you'll see on average, it's lowering healthcare costs by around 60%. That's when measured against what we all pay for healthcare on the state exchanges. And that average varies a lot by where we live, and not even just by state, but also by where we live within the state. And then one last bullet here. Over the summer, we did a survey of all of the participants in the program. And the survey came back with 91% being very or extremely satisfied with the program. So it's been very well received. And there are a number of your colleagues as well who are on the program already, as you may or may not know. Quite a number of companies have signed up. But what we're talking about today, like Sarah referenced, is really an alternative approach to traditional health insurance. In bringing the program together, we have two main partners that we've partnered with. The first is Apex Management Group, and the second is Sedera Health. So when you enroll, you're actually enrolling in two programs, one with Apex and one with Sedera. The Apex plans have two choices to choose from. And I'll get into the details on both of those in just a few minutes. And then on the Sedera side, the focus there is on the larger, unforeseen, significant type medical expenses and events that we all go through. But really, it's through Apex, it's through Apex and Sedera, along with a couple other partners in the program, that we get to a comprehensive, cost-effective alternative that we're talking about here today. The healthcare program, and really healthcare in general, has three main components. There are large costs, which we refer to as needs. There are small to medium costs, and then there's preventative care. The large costs are the significant items, everything from running your child down to the ER for some stitches to a cancer diagnosis and everything in between. The small to medium costs for more of the run-of-the-mill type stuff we all have, cold, a sinus infection, or flu. And then preventative care is just that. It's everything from childhood immunizations to your annual physical, to colonoscopies and mammograms, and everything in between. The program addresses all of these, and I'm going to quickly touch on each one of these and tell you how they're addressed as I go through the slides here. Let me talk first about the large costs. And again, these are the significant expenses that we have. It's surgery, perhaps from an accident, an ER visit, a cancer diagnosis, things of that nature. These costs are handled through our partner in the program, which is SADERA. SADERA is medical cost sharing. If you're not familiar with medical cost sharing, it originated in the 1980s and has always had a foothold with religious groups. So back in the 80s and since then, different religious groups, churches or congregations would get together and form an organization through which their members would share in each other's expenses. SADERA's parent company is actually called the CARES Group. The CARES Group is a medical bill negotiating company. And the CARES Group was also formed in the 1980s, and they're the group that many of the religious organizations turn to handle their larger bills. When our medical expenses started to increase at just an unsustainable rate, the CARES Group formed SADERA. SADERA is built upon the same industry best practices and principles as the religious organizations, but SADERA does not have a religious component to it at all. I have some questions here. Don, how many people are in this program? Don, I'll get to those numbers in just a minute. And Tara, will the slides be available to hold on to at the end of the webinar? Tara, the slides will be emailed out to you along with a copy of the recording of the webinar, I believe. Now let me talk a bit more about SADERA, because SADERA's objectives are really all of our objectives. It's compliance and credibility. It's lowering our monthly expenses and reducing our out-of-pocket costs. So depending on the plan you sign up on, and I'll go through all of the costs here in just a few minutes, you'll have a lower monthly contribution, most certainly, but also a lower max out-of-pocket cost. So for many of us who have been dealing with $6,000, $7,000, and even $10,000 deductibles or more, there's a solution here for all of that. A few comments on medical cost sharing. As I said, it is an alternative to health insurance. It's healthcare through community as opposed to healthcare through insurance. Industry-wide, as of the end of 2017, there are more than 1 million members sharing more than $1 billion annually. That number now is actually closer to 1.4 million, I'm told. So it's really caught on quite quickly. And I have a graph here in just a minute that shows you the timeline. On the SADERA component here, it offers freedom from networks. So you can go to any hospital you like, any doctor you like to get the care that you need. You do not have to operate within the network. On the APEX side, the second component of the plan you do for your preventative care, on the SADERA side, it's freedom from networks. Sharing begins at what is called your IUA. That's your initial insurable amount. That's a term to get familiar with because that is the amount you're responsible for paying out of pocket. I'll go through the 5 levels of IUAs included in the program in just a minute and explain to you how all that works. Here's a quick graph I was referencing. You can see the uptick that started in 2012 or so when all of our medical expenses started to increase at just an unsustainable rate. People started looking for an alternative. And that alternative is what we're talking about here today. SADERA talks about or refers to our medical needs as a need. So a need is one or more medical expense caused by a single accident or illness. So on the graph here on the left, you'll see this is someone who broke their leg. So there would be costs for the ride in the ambulance, surgery at the hospital, a stay at the hospital, diagnostic imaging, prescriptions and pain medicines, physical therapy. All of these costs, whether they occur over a month or whether they occur over a period of years, are wrapped up into that one need. Now, the member's responsibility is that IUA, the initial insurable amount that I referenced earlier. Our program has 5 levels for people to choose from in signing up. There's $500, $1,000, $1,500, $2,500, and $5,000. And that's the amount you're responsible for paying if and when a need occurs. So looking at the graph on the left with the broken leg, if all of those costs were, say, $10,000 and you had the $1,000 IUA, you would be responsible for, you'd be responsible for paying the $1,000. Now that holds true if the costs were $10,000 or if the costs are $200,000, your responsibility is that IUA. Now, if you sign up as an individual, you're responsible for the first 3 needs in a calendar year. If you sign up as a family, you're responsible for the first 5. As a practical matter, we all have far fewer than that in the calendar year. But if you did have a 4th as an individual or a 5th as a family, you would not have to pay that IUA. The need would be shared 100%. Let me go through a real quick real-life example. This is an example of a family with a young child. After visiting with an ENT, the child was suffering from a series of ear infections, and after visiting with an ENT, they inserted tubes into the child's ears. Obviously, a pretty common event for many children. This next slide Shows the out-of-pocket cost for the family with traditional insurance. It was about $2,500. On the right, if they had the Sedera plan with the $500 IUA, they would of course only have to pay the $500. And just a quick comments on the money flow, if you will, and how this works. When you go to the hospital, you present yourself as a self-pay patient. They bill you for the care and services that you've received. You then upload those bills to Sedera, much like filing a claim. Sedera then issues checks every Wednesday to you. They issue you a check and you pay your bills. So with this scenario here, where the out-of-pocket costs were $2,500, if you had the $500 IUA, they would send you a check for $2,025 and you pay your bills. There are some nuances to the plan, and that's membership, medications, and pre-existing conditions. Pardon me while I'm trying to match my discussion here to the slides. I apologize for the delays. Let me talk first about medications. There are basically two types of medications we all take. Those that are curative and those that are maintenance. The curative medicines, if you remember to the broken leg scenario, it could have been antibiotics or pain medicines or things of that nature. The cost of those curative medicines will be wrapped up into that need and shared accordingly. Curative medicines are medicines we take, obviously, until we're cured. The other type of medicines many of us take are maintenance type medicines. Maintenance medicines could include blood pressure, cholesterol medicines. An overactive thyroid is a common one that we've come across. I take medicine for rheumatoid arthritis. These are medicines we take weekly or monthly or daily or however they are prescribed and do for the foreseeable future. There are three ways to get these medicines filled. The first, and this is how probably 90-95% of the folks on the plan get their medicine filled, is through the Apex plan. The Apex plan is the second component of this program and offers great prescription drug coverage. That's how I get my medicine for my rheumatoid arthritis. Folks may also look at GoodRx or Liberty Benefits as well. But like I said, 95% of us get our medicine through the Apex plan. Pardon me, I'm having some delays here. Tara asks, does that mean you pay the provider up front and get reimbursed? No, Tara, that provider simply bills you. You pay the provider once you are reimbursed from Sedera. LaShawn can't hear. Is anyone else having audio issues? Hello? Sarah?
I'm here.
Okay. LaShawn said he couldn't hear. I just want to make sure.
Yeah, I'm trying to see why he can't hear.
Okay. All right. Now, when members do sign up, they do have to commit to a few things. One is to strive to live a healthy and balanced lifestyle. That's obviously not legally binding, but making smart choices like diet and exercise can improve one's quality of life, but also keeps us all out of the doctor's office and out of the hospital. Members do have to commit to not use illegal narcotics and not to operate vehicles while intoxicated. Also, tobacco users are certainly welcome to join. Everyone is, but there's a $75 surcharge per month per household for those who do use tobacco. And that also includes vaping. And just to clarify that, it's per household. So if a husband and wife smoke, there's only one $75 charge for that household. It's not $75 per member. Also, for tobacco users over the age of 50, there is a $25,000 per need sharing limit for the top 4 diseases associated with tobacco usage, which is heart disease, stroke, COPD, and cancer. I apologize for the fine print there. There isn't too much of it here. This next slide is about pre-existing conditions. It's probably the most important slide in the deck, if you will. At least it was for me, because I do have a pre-existing condition with rheumatoid arthritis. If you have any of the top 4 pre-existing conditions listed there, high blood pressure, high cholesterol, sleep apnea, or non-insulin dependent diabetes, and assuming they're well controlled with medicine, there are no restrictions to those at all. Those are obviously pretty common and generally well controlled with medicine, so there's not an issue. They're basically a non-event for you. If you have anything else, there are sharing restrictions. Now, your pre-existing conditions are defined as anything you've received treatment for or had symptoms of in the prior 3 years to joining Sedera. So when I signed up, I had to disclose that I had rheumatoid arthritis. So what does that mean? Obviously, when I go to my rheumatologist, that's covered. I simply pay my copay. My prescriptions are covered. My lab work is covered. I pay a copay when I get my blood work done. But what this is saying is if I were to have a medical need, if I were to have an event as a result of my rheumatoid arthritis, say I needed surgery, that's when these restrictions would come into play. In the first year, I could not share any of the costs for that surgery. In the second year, up to $15,000 would be shared and paid. In the third year, up to $30,000 would be shared and paid. After that, it's fully shareable. Now, for myself, with my rheumatoid arthritis, it was not an issue for me joining. It's a chronic condition, and it's something I've had for many years and will have for the rest of my life. Some common examples on when this would truly come into play would be, say I had an active cancer or is currently going through something of that nature, or say my wife was currently pregnant. Now would obviously not be the time to join, because it would create a financial burden for myself and my family, which is exactly what we're all trying to avoid. So for those of us with pre-existing conditions, we definitely need to be aware of this slide and aware of these restrictions. We could certainly have one-on-one conversations with anyone who would like to, and make sure everyone is very clear on how these restrictions work. But like I said, generally speaking, it's a great option for about 80 or 90% of us to consider, including those of us with pre-existing conditions. That is it for the large costs and the needs. That's how that works and how the money flow works. And again, when you go to the hospital, or say you broke your leg, you simply tell them I'm a self-pay patient. They bill you, Sedera reimburses you, and you pay your bills. Pull back the curtain a little bit here just to make up for the delay we have. The way Sedera saves much of their money is by actually prepaying for a lot of the procedures many of us have. So for example, if you tore your rotator cuff, and let's say you had surgery scheduled for 2 weeks from today, you would call Sedera and say, I tore my rotator cuff. You'd open up a case, and chances are they would actually pay for that surgery before you even had the surgery. The reason there is that many hospitals discount automatically by as much as 50% or more when people prepay for surgeries and they pay cash in doing so. Sedera on average saves around 47% just through managing it in this regard. Now I'm going to switch gears a little bit and talk about the smaller costs. These are cold, a sinus infection, kind of the simple things we all have throughout the year. Included with everyone's membership is a subscription to Teladoc. Teladoc's the largest provider of telemedicine in the U.S. If you're not familiar with telemedicine, it's really caught on in recent years as a money saver and a time saver. As of the end of 2017, more than 75% of Fortune 500 companies actually offer telemedicine. And the reasons are exactly what I just described. It's a money saver and a time saver. There's no more money that comes out of your pocket using the service. You don't have to go to urgent care. You don't have to go see your primary care physician, assuming you just need a simple prescription. Maybe you just need a Z-Pack, or maybe you have a simple infection that you just need a prescription for. The doctors can prescribe it to you over the phone or through your computer and send that prescription to your local pharmacy. It's a great time saver. It's an outstanding service. In fact, their app on the App Store has more than 25,000 reviews last I looked, and almost 5 stars. So it's truly just an awesome service to have. Also included is SecondMD. SecondMD is a great way to get a second opinion on anything you're going through medically, of course, and it's from some of the nation's top doctors that practice at places like the Mayo Clinic and Johns Hopkins. This is there for 2 reasons. One is there's a study that showed the average physician was 13 years behind on his or her continuing education. So this makes sure we all have the most up-to-date information available to us. And again, it's a free service. The second reason is if you're having an elective surgery, Sedera requires you to get a second opinion, and you would do that through SecondMD. And it's not a heavy lift. It's all done virtually over the phone and through email and whatnot. Also, when you get that second opinion, Sedera takes $250 off your IUA. So if you had the $500 IUA, it would be reduced down to $250. That second opinion is not binding. You make your own decisions on healthcare. But again, they just want to make sure we all have the most up-to-date information. Now I'm going to switch gears and talk about the Apex side. Again, the Sedera side is focused on the large costs and the needs that we discuss. Apex is focused more on the preventative care. So on the Apex side, there are 2 plans to choose from. The first is the basic MEC plan. That's minimal essential coverage. The focus of this plan is solely on preventative care. Probably around 20-25% of the folks who sign up for this plan, 20 to 25% of the folks who sign up choose this plan, and they are folks that are generally good health, not necessarily on any prescriptions. And like I said, the focus here is on the preventative care. And as you can see listed there, it's 100% coverage for all your preventative care needs. These are the needs that the Affordable Care Act defined: 21 for adults, 28 for women, 31 for children. This plan also provides the framework needed to set up a health savings account. For those of you not familiar with a health savings account, it's a great way to put away some tax-free dollars to be used towards any qualified medical expenses such as dental, vision, doctor visits, and also to pay your SADERA IUA. If you sign up as an individual in 2019, you can put away $3,500, a family $7,000, and those over 55 can add an additional $1,000. So like I said, this first option is a great way to get all the preventive care you need, put away some tax-free dollars to be used down the road for when you need it. The second option is actually called the Advantage Plan. This is actually the plan I am on. Again, it offers 100% coverage for all the preventative care items. It then has a more familiar co-payment structure. So when I go to my primary care physician, for example, it's a $20 copay. When I go to see my rheumatologist or any other specialist, it's a $50 copay. And lab work is also a $50 copay. The folks who sign up for this plan are folks like myself who do see doctors on a fairly regular basis, above and beyond any preventative care items. This plan also provides prescription drug coverage, which is the other reason I'm on the Advantage Plan, because I do take prescription drugs for my rheumatoid arthritis, and I do have to see my rheumatologist 3 or 4 times per year. The prescription drug coverage, as you can see, has a traditional tiers 1, 2, 3, 4, and 5. Tiers 1, 2, and 3 are generally your maintenance type medicines. Tiers 1 and 2 generic. Tier 3 preferred brand name. Those tier 4, 5, and 6 are generally more curative in nature. And those will be bundled in with your SADERA membership and paid accordingly through there. Just as a frame of reference, the medicine I take for my rheumatoid arthritis, if I picked it up at my local CVS, it was $23. If I get a 3-month supply mail order, it's $12. So it's very affordable. It's in line or even less than what I'd paid historically. Now, when I talked about the SADERA network, I made mention that SADERA didn't operate within any network. You can go to any hospital you like, any doctor you like to get the care that you need. On the Apex side, for your preventative care and for any ongoing care, like myself with my rheumatologist, you have to work within the multi-plan network. The multi-plan network is actually one of the largest networks in the U.S. There's nearly 1 million participating doctors in the network, and it's the best network we could bring together and bring this offering to you. So when you go for your annual physical or colonoscopies or mammograms or anything of that nature, they would have to be within the multi-plan network. If you would like a list of doctors within network, you can certainly query it here, or you can simply send us an email and we can run a list for you of all doctors and all facilities that are in the network for your local zip code and your surrounding area. Now let's talk pricing. I'm going to pause here and make sure that the slide loads. The pricing here is the same for all of us, regardless of our sex and regardless of where you live. This first slide is for the Apex plans. On the left is member only, member and spouse, member and just the children, or member and family, meaning spouse and children. This second column is for that basic MEC plan. This plan does not have prescription drug coverage, but does allow you to set up a health savings account. And like I said, it's a great option for those that are, well, healthier than I am, I guess. That third column is the Advantage plan. The Advantage plan has the co-payment scenario for your doctors and any ongoing care, and it also has the prescription drug coverage. And you can see the arrow next to the plan I'm on for $144.59 per month. And again, that's as an individual. So you first pick the Apex plan that best fits you and your family. And I'm going to pause again and make sure the slide loads. You then pair that with the SADERA. Yes, Becky, those prices are monthly. You then pair that with the SADERA plan that best fits you and your family. Just waiting for it to load. I'm being told this slide is not loaded. I apologize for the delay, folks. Sarah, are you able to see the SADERA slide?
I have Apex. Can you scroll back and then scroll back forward?
I did actually. Thanks.
It's back on now, Kevin, with Sedera.
Folks, I'm sorry. Are you able to hear me?
Now I can. Now we can. So if you can go back to Sedera, that'd be great. Yeah, that's where we left off.
Okay. Here's the Sedera pricing. Like I made mention earlier, when you sign up for Sedera, you can choose 5 different IUAs to choose from: 500, 1,000, 1,500, 2,500, or $5,000. For space reasons, we only have the 1,000 and 1,500 listed here. On the side here, you see MO is member only, MS is member and spouse, MC is member and children, and MF is member and the entire family. Across the top, it's banded by age, listed in the 20s, 30s, 40s, 50s, and 60s. You'll see the higher the IUA, meaning the more you're willing to pay out of pocket, the lower your monthly contribution is. And you see the arrow next to the plan I am on for $175.51 per month. Okay, here's the total monthly cost, and this is what I'm paying. This would be the same for everyone if you're in your 40s and you selected the $1,500 IUA with the Advantage plan. It'd be $320 per month. Now, for me, it was a savings of around 52% compared to what I was paying before, which was on a Blue Cross Blue Shield plan here in Maryland. Also, I had a $6,000 deductible. Now I have a $1,500 IUA, meaning that if I did get sick or similar, my responsibility there would be $1,500 as opposed to a $6,000 deductible that I would have to first meet. So for me, it's saving money out on the front end, and it will obviously save me significantly more money on the back end if and when I do need my Sedera coverage. I'm going to pause here and answer a couple questions, but also advance the slide. Tara, what would pricing be if spouse and member in different age bracket? Does it go by member's age? It goes by the member's age, correct? The member is the primary member. Oh, sorry, that was answered for you too. Is each incident have an IUA? There's an IUA for the year. Meaning if I had 3 years? No, each incident has their own IUA. Jeff, so if you broke your leg and you had the $1,500 IUA like I have, you're responsible for paying that first $1,500. If you then had a broken arm, for lack of a better example, 6 months later, that would have its own $1,500. So as opposed to a deductible that's based on a calendar year where you first have to meet that $6,000 or $7,000 deductible or whatever it might be, you would first pay that IUA on a per need basis. Hopefully that clarifies it. Also, just so you all know, we have a pretty good recording of this webinar. We'll make sure that it's sent around again. I apologize for the issues here on my end with this. On the United Servicers website, if you have not been there, it's a great website and a great page for the healthcare. But you'll find all the current rate sheets, details on Sedera and the Apex plans, as well as telemedicine, 2nd.MD, and the multi-plan provider search. I think there's also a video out there of a presentation similar to this as well, if you're so inclined to check it out. A quick summary of the offering, and I apologize, I have to upload this. I have to update this sheet a little bit, but the program is available in 49 states. It's not available in Vermont. Vermont passed a law in July that basically eliminated any and all other healthcare options for its residents except for Blue Cross Blue Shield of Vermont. So if you're in Vermont, unfortunately, you cannot participate in the program. The program itself does not need an employer sponsor, so individual employees can join. Full-time, part-time, and seasonal workers, hourly or salaried staff and the monthly cost will be paid by the employee or the employer. Many of your colleagues and members of USA that have signed up with their company. Their employees then participate, and they offset that with a payroll deduction or whatever they choose. And many of your colleagues have actually signed up. The primary reason was to attract and retain talent. And that's the primary reason why they're adding this. It's a great benefit to add. You can certainly help your employees defray the cost should you choose, or you can certainly cover it on your own. That's your policy to set, and you can certainly set whatever policy you like there. As I said, the savings is averaging right around 60%. It varies by where you live, but 60% is the average. Also, in the fourth quarter here, we're going to be adding a dental plan through Aetna, and also vision coverage through VSP, and you'll be able to add all of those through USA as well. I'm going to answer some questions here from Tara. Are there any tools available to help explain the program specific to employees? Tara, we do have tools out there. We have videos and we have documents, but also if you would like us to meet with your employees, as we have with many other USA members, we can set up a conversation and a webinar to meet with them and answer all their questions. Philip, are the rates for USA members? Can anyone get those rates? Philip, the rates are only for USA members. The only way you can participate in the program is if you're a member of the United Servicers Association. It's not a direct-to-consumer program at all. You cannot call us up and ask to be a part of the program. You can only get it through USA. So it's an outstanding reason to be a part and to continue with your USA membership. As you probably already know, it's an outstanding organization. Here's a quick way to contact us. If you have any questions, and again, I apologize for the issues I'm having with my connection here, but if you have any questions at all, or if you would like us to speak with you individually or speak with your employees, please feel free to reach out to us. Email is the best way to get a hold of us, and the best way to set up a call to have with us. Either one of those emails will work. It'll get to anyone here on our staff that can help you. The phone number also works as well, but please feel free to reach out to us anytime, and we can set up a call and discuss this with you all one-on-one or your employees. A couple of things to keep in mind as you consider this. One, open enrollment is obviously coming up. In terms of enrolling, the cutoff date is the 18th. The 18th of any month. If you enroll by that date, your coverage would start the first of the following month. So if you enroll between now and October 18th, coverage starts November 1st. If you enroll between October 19th and November 18th, coverage would start December 1st, and so on. Jeff, I see your message. I will get a hold of you when I can. Other common questions. I think I've answered all of them. Again, I apologize for the technical issues on my end. We will make the slides available. We also have a recording that we will make available to you all, and we will certainly do more of these as well in the future and answer all the questions that you need. Again, if you would like to set this up for you and your staff, please let us know. There's a short form to fill out to set you up as a company. If you would like to enroll directly as an individual, you can actually do so directly through the USA site. I believe you just have to log in to get to that enrollment link there. So with that, I'm going to turn it over to Sarah. Yeah.
Okay, thanks, Kevin. We just want to make sure everybody knows if you're interested or you want more information and didn't get that information, you can call us or email us at administration@unitedservicers.com. We have the email address that you registered with, so we will send a follow-up email with this information for you. And just so you know, yes, your membership will be confirmed before you can sign up. So you can email Kevin and fill out the forms, but we will make sure that you are a member before you get signed up. And it's an annual membership of $199 a year.
Absolutely. All right. Well, thank you, Sarah. Thank you, everyone, for your time today. And I look forward to talking to you all again.
Yes, perfect. Thank you, everybody. Have a great weekend.
Thank you. Bye-bye.